I'd like for everyone to think for a moment about the value of human life. And does one person's life have any more value than another person's life? The current fee-for-service system, healthcare is rationed out based on the patient's ability to pay. I believe it's unethical. This is criminal. 95% of the country is still functioning in the fee-for-service model. I definitely believe everyone should be treated the same.
Everyone should have access to primary care regardless of their ability to pay.
Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel Friends. We're here because everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Today's topic is New Year's resolution, physician's wellness. We have a special guest, but before I bring on our special guest, I'd like to welcome back my dear friend, Robert Longyear. Happy New Year, Robert.
Hey, Faisel. Oh, I'm kind of sideways here. It's good to be back, Faisel. Happy New Year. I took a couple weeks off from the show. I was super busy at work and also needed just like a break. So I'm super glad to be back. I think this is a really important topic. And I like the like evergreen winter forest that we're with in the background right now. I don't know if that's a new thing, but I'm here to tell you that it's getting me really excited. So I'm glad to be back. I guess that's all I can say at this point.
So good to have you back. And we can thank Drew and Jess, our producers, for always coming up with a neat video, a neat promotion, and the background and all that. I mean, I just always appreciate you, Drew and Jess. And Dr. Dan. Good to see you, Dr. Dan.
Hey, it's good to see you, Faisel.
Oh my God, what a week we've had. I mean,
yeah.
Wild week. ChenMed's now officially, we're going into Michigan. So we're going into Texas and we're also going into Michigan. It's very exciting. So we're going to be in 12 states. So Dr. Dan and I have just been, it's just one of those weeks where like every day feels like a week.
Well, absolutely. I mean, there's a lot going on, but then when you really step back and look at it and you think, this is really cool stuff that's going on, and we're growing. We're not shrinking because of what's happened to COVID. So we're really very fortunate, and it's a great place to be.
Yeah, that's right. And when I think about the doctor-patient relationship, I've been asked a lot, oh, how has ChenMed been impacted by all the violence going on in Washington, D.C. and all this chaos politically? And I said, well, at the end of the day, with doctors and patients, when it comes down to the doctor-patient relationship, it doesn't even matter what country in the world we're practicing in. We could be doing mission work today for all we're concerned. The doctor-patient relationship is one of those things that has stood the test of time. I mean, how we're reimbursed and all that, that's a different story. But so far as the relationship itself is concerned, we've always been kind of protected from a lot of the political mess. So our guest today, very excited to have our own Joel Palau. Joel, welcome.
Hey Faisel, hey Robert, hey Dr. Dan. Thanks for having me on the show. I'm excited to be here and eager to talk wellness.
Excellent. This is so neat. One of the neat things with us even exploring and playing around with social media like this is that you got Robert sitting in DC, you have Dr. Dan sitting in Richmond, I'm in Tampa, Joel's in Miami, and we're able to just come together for a few minutes, a couple dozen minutes, to talk about relevant issues in primary care. So, Dr. Dan, I'm sorry.
When you get those clocks for where everybody is, you get a clock for Richmond and a clock for DC, although that's the same clock, and then you got to get one for Tampa, which is also, I guess, still the same clock. So I guess we don't need to do that.
Tampa's at least 2 or 3 hours behind Richmond.
Are you Central? You're Central time? Oh, this is an inside joke. I don't get it. Okay. It's a doctor thing.
He's always ahead. He's always a couple hours ahead. He's always a couple steps ahead.
The days are actually slightly longer in Florida than they are in Virginia. So they get a little bit more daylight. That's the reason everybody's always happy in Florida.
Yeah. Well, for anyone who's joining us online, Dr. Dan's going to be manning the the comment section. We want the interaction. This is a great topic. I was thinking about a topic for New Year's resolution. It's a new year, New Year's resolution. And I'm hearing from different people about losing weight, eating better, exercise, drinking more water. And I was thinking, gosh, for doctors, what would be a New Year's resolution, especially for primary care doctors? And for primary care doctors, I think the New Year's resolution ought to be wellness. When I'm reading about the staggering number of primary care doctors who are burnt out, doctors who feel disconnected from why they got into medicine even in the first place, I feel that, number one, it's not because the patients are too medically complex. I feel that it's a combination of things, obviously, but the main driver of those things is, number one, is that they don't feel supported. You've got doctors doing non-doctor work. When I'm reading about doctors spending 2-3 hours a day just documenting their patient encounters, the average doctor spending less than 20 minutes of FaceTime per patient per year, that's what's burning doctors out. It's not that the patients are medically complex. So why not have a resolution for primary care doctors to focus on our wellness? And who better to have us join us today than Joel Palau, who's taking it on at a national level.
Hey, Faisel. Well, thank you so much for having me. And, of course, when you talk wellness, it's so multifaceted, right? And it's not a one-size-fits-all approach, and it's not a simple solution. And I think, there's so many variables that come into play, from the leadership level to the center level to the individual level, right? And that kind of, all comes together to make a whole ecosystem, right? So when we think wellness, it's not just that one-size-fits-all approach, and it's really the combination of factors that come into play. And I think a big one in terms of wellness is really looking at it, in two parts. There is that individual element. And a lot of times, it can be easy to blame the individual. Hey, you're not doing well. What's going on with you? But we need to remember, almost like there's a great metaphor, and it's like the canary in the coal mine. So when there were coal miners back in the day, working these mines, it was very dangerous. The oxygen levels could get really low, and you couldn't really tell. And the carbon monoxide would build up. So what happens is these coal miners would bring a canary into the coal mine. And if the canary was healthy, if the conditions in the coal mine were okay, the canary would sing regularly. So they would pause their work every so often to listen and hear, is this canary chirping? If it is, all right, we're good. We can keep working. So, but even the healthiest canary could never make it in a coal mine where the environment wouldn't support it, right? So we need to think about that with doctors. You can bring in the most, individually well physician, but if you put them in an environment where it's not benefiting or helping them maintain their personal well-being, they're only going to last for so long. So resilience is one element, but we need to also look at wellness at the organizational level and see where are there rooms to operate a little bit more efficiently with the physician in front, right? We think a lot about, we want to measure our success based on the patient experience. And that's a great starting point. It really leads us to start mapping out, that path towards better outcomes. But I think once you have a pretty good patient experience, like an outward-facing brand, you need to look inward and see what's your inward-facing experience like, and really drive it after that point from the physician's point of view. And I think that could be game-changing, especially for most organizations, because there is a big disconnect, right, with how good they're doing on the patient side versus how well they're doing on the physician side.
I can't agree with you anymore. It goes in line with what we had a conversation last week, and we were talking about, what makes patients healthy? What are some of the factors that drive patients towards health? And we know that lifestyle plays a major, major role in health outcomes. And of course, there's genetics and there's medical management. But you had said something that really stuck to mind. And you said, Faisel, if you have happy doctors, you'll have healthy patients. An unhappy doctor is not the kind of doctor that you want managing not only the medically complex, but really no one at all.
Yeah, I agree 100%. And I think, one thing that you added, which I think was so profound, is you added the extra step. It's, of course, happy doctors, healthy patients, but you added that third layer, which I was originally missing, which is world-class support. So that's kind of like what finishes the loop, right? That's what gets these doctors to work autonomously and, practice at their highest levels, right? It's kind of having that world-class support behind them. It's kind of like, in every team there's an MVP, but if it wasn't for the team, that player, you could be the best player, but you can't play alone. It could be in basketball. You don't take to the court. LeBron James, he's great, but he doesn't take to the court by himself. It's kind of like that same philosophy. They do need that world-class support. If you want to have world-class outcomes, you really need to give world-class support to your physicians.
We see in the fee-for-service world, I mean, I'm learning that interns and second-year residents are spending time memorizing billing codes. We gave a lecture, the last lecture that we gave in person, interns were coming up to us saying, "Hey, I'm memorizing these CPT codes for billing." And I remember looking at these interns saying, "My God, you're in the hospital. You're not supposed to be memorizing CPT codes. You're supposed to be memorizing how to run codes that save people's lives, not memorize these billing codes in order to get reimbursement." But if you think about it, that makes sense because most of the residency programs are hospital-based. And so they're being trained from right out of medical school with how to focus more on reimbursement and billing than they are with how to keep patients out of the hospital in the first place.
And that's a big one. I mean, I think when you look at it from that point of view, it changes the whole way you operate. It changes the focus. The focus is not necessarily always what's best for the patient. It's what's best for billing purposes. And that's, there could be a big divide there.
Yeah. So people who really need to memorize like billing codes are really like people like me who studied healthcare management and policy and not medicine. So like you think that we're not supposed to be training doctors in that, but if they end up in primary practice, if they end up in private practice, then the physician in that case really does need to know the billing codes. But I find that not surprising, just like remarkable. You heard you tell that story, Faisel. So I can tell you that I'm not surprised, but I just like, oh. But one thing that I think is really interesting to talk about, and I'm kind of on the sidelines for this conversation because I'm not a physician, so I can't necessarily talk about physician well-being. But I can talk about something we recently did at Wanderly, where we mostly work in the nursing world. And during COVID-19 in particular, ICU nurses have been under a lot of extra strain. So just fear of infection, fear of taking infection home to family, having to take care of patients and just be like absolutely just burnt out on the fact that you don't necessarily have anything that you can do for them. And also having to FaceTime their family members to say goodbye in an ICU where they're not allowed to come in there. So it's been really traumatic, particularly for that specialty. But I'd be curious to hear what both of you think about, how COVID-19 has affected the way that you think about physician well-being, what it's done to physician well-being during that time, maybe outside of ChenMed or inside of ChenMed. And then also, like, do you think that it's been a wake-up call for organizations besides ChenMed to say, look, like, people, we have to do something about this because, like, during COVID, we have to do something about this, and then hopefully that sticks around afterwards. So I just love to hear what you both think about that.
Yeah, in my personal opinion, I think it's potentially, with everything that's had to do with COVID, many organizations have had to shift their model, right? Shift the way that they practice, the way that they work, the way that their teams are, extended outward into the field. A lot of teams have shifted into remote. So, that leaves an environment to exacerbate issues that are already going on, right? If there's pre-existing workflow inefficiencies, right? And now you're adding more processes on top of that, it pretty much just makes it exponentially a more profound experience, sometimes in a negative way. And then on top of that, I think it really brought to the forefront, an element of wellness that sometimes is kind of shut off to the side, not really talked about, and that's mental health. So, your wellness is not just your physical well-being, but your emotional state of mind. And I think, at least from what I've seen in ChenMed and what, Dr. Faisel can speak to this, is we started, really focusing on that mental health component and that peer-to-peer support. And that's, I think that's been a game changer, is how comfortable we've all gotten as a result of what we've experienced, more comfortable talking about issues like mental health and and the importance of focusing on it.
Yeah, I can say, I mean, definitely seeing like what has happened in fee for service. You know, seeing, I've never, ever, ever read about nurses and doctors being laid off from hospital system, the furloughing of healthcare workers. People went into healthcare for job security. I mean, that was one of the reasons I went, besides wanting to help patients. I mean, of course, we've got into healthcare to want to help patients. But I remember, especially when I was in high school, my friends who were going into nursing school or going to medical school or just going into a health profession, part of that reason of going there was to have this job security. And this last year, when I read about practices shutting down, when I read about residents not starting their residencies on time because of layoffs, or people starting their jobs, but they're starting their job with a 10 to 20% reduction in their pay because the hospital had across the board pay cuts because of the decreased revenues from everyone not going for elective procedures to the healthcare delivery system. I was shocked. In many ways. I don't know.
Oh, I was going to say, yeah. I mean, so most facilities were laying people off, and they still have been. So certain service lines like ICU are paying nurses about $8,000 a week at this point, contingently, to actually come work for them. There's actually a supply issue, but there's also a lot of service lines that are not seeing a lot of patient volume. Things rebounded after sort of that initial lockdown period, but a lot of like nurse practitioners that were in primary care and a lot of those service lines that don't generate a lot of revenue were laying people off. And it was really paradoxical, I think, for the general public to take a look at this, because they were like, well, you're telling me that, you know, the hospitals are overwhelmed with COVID patients, and you're firing people and the hospitals aren't making any money. And that was like a very distinctly American experience that was like really difficult to explain to people because of how we pay for healthcare. And it's definitely not good. And I do think that perhaps policymakers and the general public have become a little bit more aware of these types of things, but I don't know if we're going to see any dramatic changes. But one thing that I think is really that did come out from COVID and that will probably stick around is telehealth or telemedicine, virtual care. And I'm curious, you know, what you both think about, you know, how that affects physician well-being and workflows and burnout. Does switching between doing virtual visits and in-person visits cause too much of a strain, or, you know, does just being at your computer all day make physicians kind of go, oh, or, you know, does it work? Or do people like that? I'd be curious your thoughts on that effect on physician well-being.
Well, we've got Dr. Dan has popped up over here. Dr. Dan, what's going on? Well,
no, I've got to answer this question, and then I have a question for you and Joel as well.
Okay. Joel, if you want, I can get started.
So I think you're Robert, you're 100% right. I think the telehealth movement and the shift more drastically to telehealth has been a big game changer in a positive in terms of, you know, what's come across from COVID. But, you know, when you look at it from a wellness standpoint, I will tell you there is a difference, in my opinion, and from the doctors I've spoken to and the, you know, kind of like the feeling out process we've done, there is a difference. You know, when you see a patient in person, the interaction is different, and especially, you know, depending on the population you serve, they may be used to speaking to their physician a certain way, and they may not have that comfort. You know, it's more difficult. You know, when we communicate with others, really body language is a big part of it, and a lot of that is lost. You know, we lose some of that sensation when it's virtual over the phone, and there's that gap of comfort, right? Like, you're not used to doing it this way, neither is the patient. So, you know, that can create issues as well. But I will tell you, having that little gap where you can just get up and walk to the next room, you know, the things you take for granted that you don't really realize, it can really start to add up when you do virtual and in person. So that mixture together can really be strenuous on the physician. So basically having an in-person visit coupled with a virtual immediately after, back to an in-person, it can be, you know, quite challenging.
Yeah, it's hard to get into that like sort of flow. I imagine, like, I mean, I have that in my own job. Like, I used to be in an office, and you can kind of like walk over, you have your meetings, you're kind of in like picking up coffee on the way, and like it's something that you kind of get into a routine with. And I talked to one physician back in, let's say, April, and I was like, are you going to start like doing 4 days in the clinic and 1 day like virtual follow-ups at home, because physicians have historically not really been able to work from home, and a lot of people like having that sort of flexibility. So I did ask, and this one physician did say, hey, yeah, I'm going to do my like post-surgical like follow-ups that I normally just talk to people with on Fridays virtually. So I've heard that is potentially adding a little flexibility in place as well.
Yeah. Now, you made a comment at the beginning, and since we're not getting a lot of questions, I thought I would ask the question. You said, happy doctors make for healthy patients, but how do you define happiness? I mean, it's not sitting around drinking beer with your shoes off on the beach somewhere. I mean, that'll make you happy for a week, but I'm just wondering what you all think happiness is, the kind of happiness you're talking about.
I would say that, especially when it concerns with physicians, it's the feeling of being fulfilled. They're pursuing their life's passion. They're pursuing their life purpose. They've invested a lot of time, many years, to be at a position where you can say, oh, that's nothing. Don't worry about that. And you can just move on with your life. I think what we're talking about is that we have a state right now where most of the doctors in the country are not recommending their children to pursue medicine, because medicine has gone so far away. The business of medicine, the practice of medicine has gone so far away from what any of us were trained, or any of us even thought of what medicine would be, because of the billing nature of waiting for a medical intervention to take place, rather than focusing on the preventing the issue from happening in the first place. We're constantly just having to react, and we're working in systems, especially in the fee-for-service world, where they're just constantly focused on that transaction. They're so focused on the transaction rather than the patient in front of them. It's a whole concept of focusing on the patient's chief complaint that most of the time is the minute clinic visit, rather than the doctor's primary concern, which is what's going to keep patients healthy and out of the hospital. So I feel like with telehealth, going back to what Robert was asking about, the switch with going from, especially like in our world where we see our patients on a monthly basis, to go from seeing the patients monthly and being with them monthly and interacting with them in person to telephonic and video, virtual, was a big shift. But we were able to make that shift in less than a week, which is quite remarkable. And one of the learnings, the incredible learnings I had with switching to the virtual model. Now it's different. I would imagine that the experience is different with younger patient, with younger patient populations. But in our world, where our average patient's in their 70s, 72, 74 years old, I found something interesting. Seniors FaceTime or video chat with very few people. They FaceTime and video chat with their grandchildren. They don't even FaceTime or video chat with their own children. And suddenly, as their primary care doctor, who I already had relationships with, most of my patients obviously very well outside of that, but I established new patients as well, completely virtually. First time that we interacted with each other was in a completely virtual manner. And there was an intimacy there, where they are now walking around and showing me the refrigerator. I'm getting to see their living environment that I never could have even imagined before. And there was an intimacy there. There was a comfort there. And in my world, where our doctors are, the incentive is there to keep the patients healthy and to avoid the patients from having any kind of unnecessary complication, resulting in unnecessary specialty visits or unnecessary emergency room visits. That trust that we're able to build in that manner, yes, definitely, I would say there's nothing as good as building trust face to face. But as it has become more socially acceptable to exist in this virtual manner, there is something unique about having that doctor-patient relationship with patients who only FaceTime their favorite grandchildren. They don't even FaceTime their own children.
Yeah. Faisel, I told that story. It's in a chapter in my book, actually, that when you talk about this. So I sent it to you. I think that's great, and I think it's really interesting perspective that you bring on that. And Dr. Dan, to answer your question, so not that I'm a physician, but I think this like deep level of fulfillment in anybody's life about what they're doing is sort of like what happiness is. And I've heard it said that like happiness is actually like the experience of joy or happiness is an extreme. And sort of like your day to day is sort of being in the middle, looking for, being able to experience joy on sort of a more frequent basis, but like your kind of contentment is actually what people should be striving for, which comes from a sense of duty and a sense of like actual having balance in life and making sure you're taking care of your well-being and your, physical well-being and your health, as well as your sort of mental well-being. And so Joel, I do have a question for you as we're sort of getting towards, the end here. One thing that I always like to bring up is like what people are watching this, we're talking about it, we're saying a lot of words. What can, if there's physicians watching or people who manage organizations that have physicians or any healthcare provider, what are some tangible things that you have done that they can learn from to take back to their own organizations to improve well-being?
There's many different things, but I think one big takeaway is that, when you look at, overall satisfaction and you look at your overall perception of the organization, right? How an individual employee perceives the overall experience at an organization, it's oftentimes tied to their experience and perception of their direct leader. So the way you experience and perceive your direct leader, that basically paints a picture of the broader view of the organization, because you look at that leader as an arm or extension of, of the global brand. So I think a lot of companies can really, what skills are you looking for when you're cultivating a leader? A lot of times it may be administrative, it may be their clinical experience, but it's not always their ability to instill well-being in their team and really engagement in their team. So I think making a bigger portion of leadership development that, like, how well are you able to engage and drive well-being within your team can be game changing, especially for most organizations, because that's not necessarily a standardized part of leadership development and training. So I think leaders modeling that well-being experience and can really be, a great step in the right direction for most organizations. And it sometimes is a little bit different than the avenues that they typically pursue.
Yeah, and it's a productivity investment. That's the thing. So like, if you have happier workforce, if you have more people who are well and not burnt out, then you get more productivity, you get more creativity. And for whatever reason, like the corporate environment in particular is really not like figured that out on their own. And it's like, we're going to work people, we're going to get them coffee, they're going to get in there, we're going to grind them to the, absolute bit. And it's like, well, if you actually want to promote productivity, then it's about creating a culture of productivity. It's about creating a culture of wellness so that people can actually, get their work done and be productive and be their full selves and present at work. I mean, I know when I've been like really grinding at the end of the week, I'm like sitting there and I'm like, I did not get anything done today. And I was like, I need to get stuff done, but it's like too overwhelming for me to even like think about. And I didn't give myself space. And I think that, having leadership and managers that actually are, that's a core competency for them. Like how well are their employees or their direct reports is a really, really good, suggestion, pretty tangible.
It is. I mean, that's what most, and especially when you're talking about managing physicians, and you're talking about physicians who are managed, primary care doctors managed in the outpatient setting, most of the time the metrics are, okay, how many patients are you seeing every day? That's the metric. And how good and their direct supervisors are responsible for making sure that they're generating revenue, that they're referring to specialists, that they're ordering these tests. There's no metric that is looking at physician satisfaction.
Faisel, there's a question here that may tie into what you're saying. It's, why do most physicians feel they do not get paid well? And I mean, is it a matter of payment, or is it a matter of what they're doing?
That's a great question. When you look at how many hours, I mean, if you take it back to residency, and I'm sure there are people who can calculate these numbers better than I can right now, But when you look at residency, typical residency training, on average, we were working anywhere between 80 to 100 hours a week in medical training. Okay, this is postgraduate, this is after completing medical school. And we were working shifts between 16 and 30 hours per shift. And I can tell you that my residency stipend was, which I thought was pretty good, was $50,000 to be working 80 to 100 hours a week. So if you're looking at even just 100, if you're looking at 100 hours a week, 5,000 hours, 5,000 hours in a year, and you divide that out by $50,000. Yeah, that was a lot of work, and for that kind of pay, and the kind of work we were doing was life and death work. Oftentimes there'd be a hospital with 400 plus beds, and you have 4 or 5 residents who are managing that hospital over the weekend with a skeleton crew of nursing staff. So an incredible amount of responsibility for low reimbursement, and that was residency life. And then when you go from residency into practice, and you get out into practice with $250,000 of student loan debt, which is just absolutely ridiculous. And you're starting off your life. Most of us are starting off our lives in our low to mid 30s with our first real job, so far behind, and the hours that you're having to put in. Like I said, every doctor is spending 15 minutes documenting each patient encounter. They're spending, on average, 2 to 3 hours every day just doing the work of medicine, not even including touching the patients. Oftentimes taking that work home and doing it after 8 o'clock, between 8 to 11. I remember before leaving the fee-for-service system, my time to get work done was I'd come home, spend a couple hours with the kids, and between 8 and 8:30, I'd get on my computer and get my work done until 11 o'clock at night. So yes, many doctors do not feel that they're getting reimbursed properly for the amount of work that they're being put in. And by the way, if a doctor makes one mistake, one dosage of a medication at the wrong frequency or the wrong dose is a poison. So we are held to a standard that where even if any little minute mistake, or even if we say something in the wrong way, or we insinuate some words in the wrong way, could literally be the difference between life and death. Many of us wonder, is any reimbursement worth it?
Dr. Faisel, I think 100% you are on track. I mean, when we look at, satisfaction, especially, this is my opinion, but when you look at satisfaction with pay, it's not about the number. It's about, you have to compound a lot of other factors into it. You can't just look at the number and think, wow, that person gets a lot for what they do. You have to take into consideration relative to what, it's based on, you consider how well you're paid relative to your experience. What is your day-to-day like? And then also relative to your personal sacrifice. What have you given up to get to that point? So really, it's more inside of that measurement than just the number itself. There's really a lot to it. And then, of course, like you mentioned, the risk, right? So it's really the personal sacrifice, the risk, and then also that day-to-day experience that really all ties into play when you really measure, is it worth it? And that question, sometimes can be hard to answer depending on the situation. But the more we focus on physician well-being, the easier that question is to answer.
Yeah, I have my final comment, since we're wrapping up shortly, is I worked in a subjective well-being lab, a psychology lab in college, and one of the big things in that field is looking at income, happiness, kind of how they trade off, basically. And the general idea right now is that after about $70,000 US, and this varies culturally and everywhere else, after about $70,000 US, happiness drops off significantly. So once you reach that level in the United States in particular, you don't get more happy with dollars after that. Your sort of marginal happiness does not increase beyond that point. So that's the point at which the psychologists say you need to look at other things in your life to find happiness and fulfillment. If you're seeking money, that's not going to necessarily bring it for you. So that's my final point. Topic that I certainly am not an expert at. So just glad to be here, guys, and glad to be back on Fries with Faisel.
It's great to have you back. And Joel, I want to thank you for taking the time this week to come join us. This is going to be a recurring theme. I'd like to spend 2021 talking about physician-centered delivery of healthcare. The focus should be on taking care of doctors first in order to get healthier patients. Dr. Dan, thank you so much for manning the comment section.
Absolutely. It's great to be back again. Have missed being with you.
It is great. It's great to have you. It's great to be back. I love the engagement with the audience. I love the questions. I'm looking forward to this year. I really want it to be about physician wellness. I want that we have themes that are focused on improving the doctor-patient relationship. To our audience, people who've been interacting, this has been great. We had a bunch of random questions that were kind of all over the place, which was nice. And we hope that that you'll come and join us again. Thank you so much for joining us. For more information about today's topic and to explore opportunities with ChenMed, please visit chenmed.com. We believe access to primary care is a right, not a privilege.